They were told they'd get treated for their bad blood. Instead, hundreds of poor black men became participants unknowingly in a shocking and truly shameful chapter of American medical history. In 1932, the United States Public Health Service launched an unethical research project to examine the effects of untreated syphilis. The project was called the Tuskegee Study because it recruited 600 black men living in Tuskegee, Alabama. Researchers told the men that they were being treated for bad blood, a term used locally to describe anything from fatigue to anemia. They promised the men free medical treatment if they participated. While 2/3 of the men in the study were confirmed to have syphilis, not one received proper treatment for the disease they had contracted.
So this was a study in which there was no consent on the part of those who were being studied, also deception on the part of the U.S. government.
When penicillin became the recommended treatment for syphilis in the 1940s, Tuskegee researchers scandalously withheld the drug from the men in the study so that they could continue to chart the course of the disease when untreated. Many patients experienced damage to their vital organs and nervous systems, and for some, the lack of treatment led to death.
The great shame of the study is that the men thought that they were being treated. Treatment was withheld from them, even after it was very clear what kind of medical treatment would cure them of syphilis.
In 1972, an Associated Press article exposed the Tuskegee study after one of the participants brought the story to a civil rights attorney. Only then, after 40 years, was the study brought to an end. The case was settled out of court for $10 million.
This long history of medical experimentation on African Americans creates a sense of distrust. A distrust of doctors and physicians, a distrust of medical care.
In 1997, President Bill Clinton formally apologized to the victims of the study. The president's apology was a welcome first step, but we still have a long way to go before the legacy of mistrust of science within the black community is fully overcome.
This article brings light to the term scientific racism. It shows that scientists argued that African American men were uniquely fit for enslavement. They argued that African American men did not experience pain as white people did. This is a classification of cases in the Tuskegee study. This study was not being reported in the news at all in the 40 years. It wasn't until November 16th, 1972, that Peter Buxton leaked information on these patients. Many of them had already died, and families were infected also, and children. I found this article in the Rutgers Library database. It's a mirror image of the Tuskegee study, but it was done on Guatemalan men. It's a pretty interesting story if you read it. Still pretty immoral, but they actually gave them the penicillin to see how the effects worked. But their choice of injecting them was to send prostitutes who already had the disease. And then if the rates were not high enough, they actually would lacerate their private areas and use a cotton ball that has syphilis on it and directly inject it that way through the private area of the men.
We're also seeing what's known as the Tuskegee effect, which experts and civil rights advocates say go to the heart of many Black Americans' long-standing mistrust in the healthcare system. Much has changed since the Tuskegee study. Under the 1974 National Research Act, medical researchers are held to the highest ethical standards, and the law guarantees that safeguards are in place to protect research volunteers. Healthcare advocates for Black communities also point out there's a very important difference between anti-vaxxer groups, who often spread disinformation, and Black Americans who have a very real and justified skepticism of doctors and researchers. They say one way to build trust and confidence is for government, doctors, and medical researchers to prove they are trustworthy.